Implementation of the Distraction-Free Bundle for Nurses During Medication Administration, by Emily Falkenrath. Medication administration errors in hospitals are the result of multiple factors, most of which are preventable in nature, yet have a substantial impact on patient safety and outcomes. While there is no proven correlation yet, interruptions during the medication administration process are thought to be a significant contributor to medication administration errors. Therefore, it is imperative that nurses discover ways to minimize the number of interruptions and distractions encountered during the administration of medications. This safety plan will utilize the implementation of a distraction-free bundle in order to minimize the number of interruptions and distractions encountered during the medication administration process. In any one hospital, thousands of medications are administered by nurses to patients each day. Errors in this process are frequent and their impact is substantial. To date, no randomized trials have been completed to assess intervention effectiveness. Rather, only small studies with limited statistical analysis currently exist. Because approximately 1 in every 5 dosages of medication that is administered to patients results in an error, there is a significant impact on the healthcare system in terms of both financial and patient outcomes. Implementation and utilization of a distraction-free bundle within each hospital unit will help mitigate the risks associated with the medication administration process. A medication error is defined as any preventable event that may cause inappropriate medication use or patient harm while the medication is in the healthcare professional's control. According to the 2013 Journal of Patient Safety, the number of people who die yearly from preventable medical errors may be as high as 440,000. 1 in 3 patients who are admitted to the hospital will experience a medical error, most of which are medication-related. The cost of preventable medication errors is approximately $21 billion. The distraction-free bundle consists of 5 interventions that will be implemented in a staggered form, as to not overwhelm the staff who will be responsible for implementing and utilizing it. Included are the doctor time checklist, the patient and staff education, implementation and utilization of a multidisciplinary task force, implementation and utilization of interruption-free zones, and a designated call light system. The checklist goes beyond the 5 rights checklist that most nurses are familiar with. This checklist also cues nurses to look at the medication's expiration date, assess for potential side effects, and to document all aspects of the medication administration process appropriately. These checklists will be placed near every PICSIS, each stationary medication station on the units, on every mobile medication cart, and will be included as required documentation under every patient's electronic medication administration record. Education will be provided prior to the implementation of the bundle, and monthly during unit-based staffing services. Interactive workshops will be held, depending on each unit's need, in an effort to create a comfortable transition to using this bundle. It is important to also include the implications of medication administration errors as part of the education for staff members, the hospital, and patient, in order for employee buy-in to occur. Leadership must also be present and engaged throughout the entire process, from implementation onward. Patients must be educated on the importance of the bundle, and how it will improve their safety and outcomes. The multidisciplinary task force is a diverse team of professionals that includes hospital leadership, physicians, pharmacists, risk management, and of course, nurses. The task force will be responsible for assisting with staff education, the implementation process, monitoring for compliance, and making adjustments to bundle accordingly. Unit-based task force teams can also be utilized as part of a shared governance principle, in order to promote staff engagement in this process. Clearly marked interruption-free zones will be designated in medication rooms, and at all stationary medication stations throughout the unit. A separate call light system will be installed above patient room doorways, as well as at the nurse's station in order to alert coworkers that a high-risk activity is in progress and the nurse is not to be interrupted, unless it is an emergency. Before implementation of the bundle, measures will include nurse characteristics, unit information, medication administration details, the type of interruptions observed, the physical location of each interruption, and the source of each interruption. Currently, no benchmarks exist for minimizing interruptions during the medication administration process for nurses. Collected data will be entered into a hospital-designed data collection system. Data collection will occur daily by members of task force, and observations will be documented on a standardized data collection form. Observations will be collected for 1 month pre-implementation through 6 months post-implementation. It is difficult to predict what our projected results will be, as previous studies have shown a wide range of results. For the purpose of this project, results that show a consistent downtrend in the number of interruptions over the 6 months of monitoring will be considered significant. The patient is considered the most important stakeholder, as they will pay the ultimate price for any errors that occur during the medication administration process. Most patients want to leave the hospital in better health than when they arrived. Anything outside of this is typically viewed as unacceptable. Hospital leadership allocates funds towards the project, is responsible for the project's approval, and is present during staff training. Cost related to MAZE significantly affects the organization as well, with each medication-related adverse event costing the hospital approximately $11,000. Finally, MAZE can lead to a decrease in the nurse's confidence, their administration of harsh punishments, the threat of litigation, and many other harmful side effects that can impact the nurse both mentally and emotionally. With regards to the unfreezing stage, overcoming individual resistance or group conformity against the adoption of this bundle will require education. Frontline staff must understand why the current status is no longer sufficient, and what their impact will have on the project's forward movement. The change movement itself occurs with the implementation of the bundle. Here, nurses will be able to experience the positives and negatives associated with each intervention, and gain a better appreciation for what this process can do for them. With time, their desire to follow the bundle will outweigh their desire not to. Once all elements of the bundle are implemented, evaluation of its effectiveness can occur using the aforementioned outcome measures. If found to be a positive change, the bundle can be adopted as a hospital standard of practice, to be used by all nurses within the facility. Staff engagement will continue to be a crucial component to the bundle's ongoing success. Technology requirements include the following: hospital-wide electronic medication administration record system with bedside barcoding capabilities. Smart infusion pumps that are capable of wirelessly transmitting data to both the pharmacy and the patient record. A new call light system that will indicate a high-risk process is currently in progress, and a data collection informatics system that is used to collect, analyze, and share project data. Implications for future use include undergoing further research, being included in other interventions that are focused on decreasing the number of medication errors, or being used in isolation on a much larger scale. Ultimately, this bundle has the potential to improve patient outcomes, lessen the financial burden on the organization, and give nurses a sense of empowerment, achievement, reassurance, and pride, as they will be the driving force behind this project's success.